GT, taking retail delivery from dealer stock by 11/30/2016. Most awarded plan based on the cumulative total of recognized corporate, national, and regional awards for the 2015 model year using Ford methodology. Sales plan based on the 2015 calendar year sales.
Hey guys, watch my new bike trick. Whoa!
Accidents happen. When they do, LaPorte Hospital can help you get on the road to recovery faster. With our 30 minutes or less ER service pledge, we will work to have you initially seen by a medical professional in 30 minutes or less. Less waiting, faster care. The 30 minutes or less ER service pledge at LaPorte Hospital. During a medical emergency, every minute matters. That's why, at LaPorte Hospital, you'll find less waiting where you need it most, in our emergency room. In fact, we will work to have you initially seen by a medical professional in 30 minutes or less. And because we're a full-service hospital, we can provide more care if you need it. Less waiting, faster care. The 30 minutes or less ER service pledge at LaPorte Hospital.
Another great edition of Younger Life Live on this wonderful November 10th. I'm Rick Federici.
And I'm Mary Anthony. And you're not just Rick Federici today. Your birthday boy, Rick Federici.
Ricky
today.
Federici
you're
turns
50
50.
today. Today's
Annie,
a big day.
Our wonderful guest came in today and she's like, whoa. Did you think it was a little crazy when you walked in here or what?
Definitely a little crazy. Lots of food.
Yes,
Awesome.
lots of food.
Awesome.
Lots of awesome food.
Yes.
Yeah, we had Sweet Lou's bring some food in, and it's been a fun morning so far.
So
it's
far,
a
and
great
I thank
way.
you. I thank you for
definitely,
the great energy, the great attitude, the positive vibe. Younger Life Live, that's our whole focus here on this show as we roll through this each and every weekday, 9 to 10. You could watch this right now with Patty, myself, and Mary on Younger Life. Of course, on YouTube. So it's Younger Life, little space, live. So you could see it, you could hear it on our radio station, WIMS, AM 1420. I'm excited about today. This is a good one.
I am too. We're having a great discussion. And I had a great time actually doing a little bit of research. When I knew we were going to be talking about urgent care, I was trying to think, okay, what are the common things that people might want to know? So I had a really good time kind of reading about it and thinking, really getting to the bottom of what urgent care is. So first of all, Patty, would you mind to tell us who you are and what you do at LaPorte Hospital?
Sure. My name is Patty Johnson, and I'm a director of practice management with LaPorte Physician Network. So that's a group of employed physicians that is with the hospital, and I manage several of the different practices. One happens to be urgent care. And I've been at the hospital for about 7 years, and I've been in healthcare for 21.
Oh,
wow.
really?
Yeah.
This has always been a passion
Holy
for you
cow.
then on some level, huh?
Absolutely. Taking care of people is really fulfilling.
So the 21 years, is that something as a young lady, when you went to school, did you go to college, obviously, if you don't mind me asking, and so you did all that training and all that fun stuff? Kind of hard at that point? My daughter is going for nursing right now, and I tell her, focus. Is that kind of what you had to do? Absolutely,
but I kind of did it backwards. So I didn't go to school right away. I dabbled in a couple of different careers
Sure.
and looking at things, and then healthcare just kind of fell in my lap. And then after that, this is what I want to do, and went back to school, got my MBA in healthcare management. So that was just, it all came together. It just worked out perfect.
Well, you know, we talked a couple weeks ago. That was a vocation then at that point. That was like a calling for you, you know,
Yes.
from that point forward. Once it fell into your lap, you really realized that is you. And I love that. And I love that you point out it doesn't have to be going to school straight out of high school.
Yes.
I think for so many people, you know, we want that for our kids. Of course we do. We tell our kids that, you know, but sometimes they honestly don't know what they want to do, or, you know, and college is so expensive.
Yes.
That, you know, at least it's nice sometimes when you say, okay, so maybe I didn't make all the best decisions at that time as far as knowing what I wanted to do and shoot straight for it, but you do now, and then you go for it. And I love that. Those are my favorite stories, when you really find who you really are.
We
I
all
think
know
it's
in this
fantastic.
room too, with children and people in our lives, including ourselves, that every single person, whether it's your 5 children or my 2 daughters or whatever it may be, everybody's got a different groove in life. So they're so different.
Yeah,
You know what I'm
Patty
saying?
shared with
So
me
it's
she
a
has
nice
4
thing.
kids, so she
4.
too
Yes,
knows,
I do.
you know, and
Yes.
that is, it's so nice when you find that, and what a great example for your kids to see too, that, you know what, even if you didn't know right away, you know now, and that's nice.
Right, absolutely. You don't have to get stuck in something. Try a few things out, and then once you get that comfort level and you feel this is right for me, then you can pursue it as far as you want to pursue it.
I love the fact too that, and I explain this to my daughters, no matter who their significant other may be or where life brings them when it comes,
Right.
you know, if they have a partner or married life, but I always feel that everybody in life should do something that they enjoy. You obviously enjoy what you do, correct?
Absolutely.
And
I
it
love
fits
what I
within your
do.
family schedule.
Yes.
And all that stuff.
I make it work with the family schedule. And I think my children also appreciate the fact that they know that if I'm not home or I'm home late, it's because I'm taking care of somebody.
Yeah.
I'm helping take care of somebody. Maybe not directly with my hands on them, but in order to help the physician or whomever take care of them.
That's wonderful.
Yeah.
Do you find, you know, in the healthcare arena, you've been in there so long, have you found it's very different working with the patients and then working with the doctors now? They do the physician side. I mean, clearly you still work with patients, but you're kind of running these physicians' offices too,
Yes.
you know? So have you found that is very different or very much the same?
Well, I would say, I mean, it is different from the aspect of looking at the physicians and, you know, trying to get them to understand the patient needs. And the majority of them, of course, all they're there to do is take care of that patient.
Right.
And that's the center of what they want to do. And then getting the colleagues involved as well to say, you're here to take care of the patient. It's about the patient and it's not about yourself. So I think that's really fulfilling when that you see that all come together. And patients leave and they're happy and they're excited, or if there is something that's not as, you know, good news or something that maybe is a little difficult to handle, they all come together. The office comes together, the physician comes together, and they really work to help that patient through
That's
things.
nice.
So, I mean, I think it's just rewarding overall.
Aw. So the urgent care thing, though, I really wanted to know, you mentioned that you do that as well as the physician offices. Can you kind of tell us what urgent care is all about? What is urgent care?
Sure. So urgent care really is an option for people to receive health care that is not a life-threatening type of issue. So if it's a non-emergent issue, it's definitely a choice that people can go to. And most don't realize what we can do at urgent care for them. So urgent care really is a place that they can go if their doctor's on vacation or out of the office, if they can't get into their doctor for some reason, holiday time and physician offices are closed, they can go there. So it's something as simple as maybe I have a sinus infection or an ear infection, to something more serious of I may have fractured my wrist, or I have this deep cut, I need to get that sutured and stitches put in. They can come to urgent care and get that done.
I was going to say too, from a standpoint, I think part of the reason too I want to bond and talk about this program today is because I want folks to understand, to get educated on 2016 urgent care. In other words, is this a 24/7 operation as well?
I wish it was a 24 a week.
Perfect.
Monday through Friday, we're open from 8 a.m. to 8 p.m.
Oh, okay.
Saturday and Sunday, we're open from 8 a.m. to 4 p.m. And then we're open on holidays, except for Christmas Day. So that's the one day that everyone spends with their family
Yes.
and gets to enjoy that
Certainly.
day. But we are open, so especially like Thanksgiving Day, Christmas Eve, New Year's Day, those type of holidays that typically everyone's going to the emergency room and filling up the emergency room with small issues, they can go to urgent care.
So you just brought up a great point. This is something I
Yes.
wanted to clarify
Sure.
that I wanted to clarify for myself when I was reading, and for our friends out there that are listening. Urgent care is not an ER, right? It is not an
Correct.
emergency room. It is different than an emergency room. It is, what are some of the other terms? Like I was trying to look up some of the other terms, after hours.
Yes. After hours, immediate care, express care, things of that nature.
Okay.
And I think the way that people can think about it is if it's not a life-threatening type issue, I'm having chest pain or, numbness and stuff in my face, or, my limb is cut and really, really bad where it's
Right.
hanging, they can come to urgent care versus going to the emergency room. Typically, we get through the patient faster.
Okay.
They don't have as much, and it's definitely less expensive.
That's what I wanted to
less expensive
ask.
than going
Yeah.
to the emergency room.
How does that work then? If someone comes in, they've got a situation, and it's like a now thing. When they come in, do they fill out paperwork? Is it kind of like they're walking into the office and then they're taken care of? I kind of would like to. I know that may sound, a little ABC.
Right. I mean,
on
you
this,
want to make
but-
sure
right?
no appointment is needed,
Right.
no referral is needed.
Right. So no referral is needed. No appointment is needed. It's basically kind of a walk-in. So you walk in just like you would walk into your physician office.
Mm-hmm.
The first thing we do is we ask, what are you here for? What's going on? And then we ask for insurance or what kind of, financial situation are you in,
Yes.
so we can get that processed. Then after that, we really strive to have a short wait time. Usually our average wait time is between 15 and 30 minutes. So we get you back, we triage you. The physician comes in. If there's standard things that need to be done ahead of time before the physician comes in, example, you come in and you think you may have sprained your ankle, you don't know if you fractured it. What we'll do is we'll take that patient back and we'll get an x-ray first.
Wow.
So then when the physician comes in, he has more information and it takes that visit from being longer to shorter because we can expedite it and go a little bit faster.
Well, that's really nice. You don't have to say, okay, now we're going to need to send you out for an x-ray. It's nice you can
Yes.
do that right there on the premises. Can we go back for just a second when you were talking about insurance?
Yes.
So is a patient expected to pay for the visit that day if they do not have insurance or if they have co-pays? And is there assistance available for those that may still need the care but can't pay for it that day if they don't have insurance? Or how does that kind of work, if you don't mind my asking?
No, that's fine. So when you come in with insurance, some insurances have a copay for a physician office, urgent care visit, or emergency room. So if your insurance requires a copay and has a copay on for urgent care, we're responsible to collect that copay for the insurance company at time of service. So we would ask for that copay at that
Certainly.
time. If insurance comes through and it just doesn't indicate a copay, maybe has co-insurance, we ask for a minimum payment of $45.
For anybody?
For anybody.
Okay.
Now, if someone comes in, they don't have insurance, maybe their economic status is not well and they're struggling, what we will do is we'll ask for something for them to pay for something, and then we can get them set up with a financial counselor from the hospital, and they will look at it and see, what can you qualify for? Do you qualify for any of the healthcare exchange products, or do you qualify for Medicaid, or what can we do to get you signed up with some type of insurance, or what can we do to set up a payment plan for you? So we don't turn anyone away because
That's
they don't
nice.
have insurance or because they don't have $45. We will still see that patient and take care of them.
I think that's wonderful
It
because,
is.
I mean, from that standpoint, folks, and I want, again, this is a great piece of knowledge right here
Absolutely.
on Younger Life Live, brought to you today by the LaPorte Hospital. We thank them for their sponsorship. No excuses, in other words.
Well,
you need the
yeah.
help. We could take care of you, even if, there's
Well,
some unique circumstances.
Right. I feel like I think a lot of people would be apprehensive if they were afraid they were going to have to pay for it up front and said, oh, my kids might have, insurance, but I don't. And I slice my finger and I just say, forget it. I can't go because I can't pay for it. I want people to know still, if you need to go. There is a way,
Absolutely.
and it's, I think it's amazing that you guys help them figure that out, work with them to figure that out. So
Yes. Yes.
I think that's important. I was curious to know who sees the patient then. You did mention a doctor, so there is a doctor on site, not...
Well, we have different types of providers, so it kind
Okay.
of depends on the day. So they're not, there's not necessarily a physician there every day. So we have physicians, medical doctors that are there. We have our mid-level providers, which are physician assistants and nurse practitioners. But at the same time, if they're there, they always have a connection to a physician if they need to. They're very experienced that are in there. We have a lot of physicians that kind of rotate through from the community that pick up different shifts during the day. So there's some constant providers that are there, and then there's others that you're just going to see kind of filter through that are, trying to build their practice or doing more.
Maybe newer doctors
Yes,
too,
newer,
kind of
yes.
meeting patients. I'm curious,
Yes.
are these all LaPorte Hospital physicians then? And
Yes.
I think that is really cool. That's a great way for patients to come in contact with the doctor before. Sometimes when you're picking a new family doctor, you just pick one based on what somebody else says. You have not met. Say, I really liked him or her, and
Yes.
want to kind of go to their practice. I think that's a great way.
Yeah, so especially if they come in and let's say they need to have some kind of follow-up.
Right.
And we say, follow up with your primary care provider, and the response is, I don't have one. So what we do is we will try to get that patient scheduled with someone within our network. And if it is one of those providers that are building their practice, they can say, you can come see me. I'm just right across the parking lot, or I'm over here, and you can make an appointment with me and follow up if you want to.
That's neat. That was a question too that I was thinking. What happens? Lots of times you have to follow up. So what happens for those
Yes.
patients that don't have a doctor? There we
We
go.
just had a text message asking about, can you give out the location
Oh, certainly.
of this particular place? if you
Sure,
wouldn't mind?
absolutely. So our urgent care is located in Sagamore Plaza, which is right off of Monroe Street.
Sure.
I think before, what's the name of the street? Before Boyd Street, if you're going south. The address is 508 Legacy Plaza West in LaPorte. And the phone number is 219-575-6244. And again, you don't have to have an appointment. If you want to, we do have something that's called online check-in. So online check-in, you can go onto our website, which is www.laportehealth.com. And when you get on, at the top, you'll see different words. One says services. If you hover over services, you'll find urgent care. When that comes up, it'll show times that you can check in for.
Wow.
And it's kind of holding your spot and not waiting in the waiting room, but saying, okay, I'm going to check in for a 2:30 visit. And then that way you don't have to sit there and wait, and it's a little more convenient for you. So
That's nice.
it's
I
not
love that.
necessarily an
I think
appointment,
that's very convenient.
but that's a way that you can do
Similar
kind of
to an appointment. That's nice. I mean,
Similar,
it helps. It helps out to give you a timeline as far as the patient, and
Yes.
lets you guys kind of know who's coming and
Absolutely.
what's going on there. I had a question that I thought really a lot of people wonder about. So will my primary care physician be aware of my visit to urgent care? And if there are any tests done, how does my doctor receive that information and test results?
Yeah, that's a really, really good question. So if they come into urgent care and they have a physician that's part of our physician network, we get that information for whoever that physician is. And then right now we're all on the same electronic medical record.
Oh, yeah.
So that physician can actually go in and see the visit, see the note, see anything that was done. If lab results come in, we put a copy on those results to go over to that physician. If it's a physician that's not part of our network and the patient will tell us who the physician is, we can fax over the progress note
Okay.
and get that information over to that physician so they know what was done, what we recommended for follow-up, and then they can take it from there as far as contacting the patient to make an appointment.
Wow, that's fantastic. I mean, and that helps complete cycle of care then, you know what I
Right.
mean? That's really,
Because if
really
they have a
good.
follow-up, we really want them to follow up with a primary care provider, especially if maybe it's an issue that's going to go on for a while. Some people tend to come back to urgent care and do their follow-up at urgent care, which is okay, but really we want to get them into a primary care provider so that person can watch and monitor what's happening or make changes if necessary.
If someone was to, come and utilize the services at that point, if there was a need for medication, would the medication be dispensed on site, or does it go like to their particular, whoever they may be getting the medications from?
Yeah, so if they do need medication, we ask for their preferred pharmacy. And what we do is it's called eScribe, and we send it over electronically to that,
Pharmacy.
to the
Basically,
pharmacy,
pharmacy,
yes,
sure.
I couldn't think of the word, to the pharmacy, so that way they can go, it'll be ready for them to pick up. Some of the medication does have to have a prescription, so we will write the prescription, they have to take
Oh,
it to the
really?
pharmacy itself.
Versus the E1?
Yeah, so if it's pain medication, if it's anything considered a controlled substance, that has to be on special prescription paper.
Wow.
And you have to actually take that to the pharmacy.
I
think
didn't know
it's a
that.
smart move.
It is a smart
Yeah.
move. It's nice to see, especially with, we've had, Sheriff Boyd on. We've discussed drug issues a
Yes.
lot.
Yes.
And in our area, it's nice to know that's a small change that I think is very proactive, though, in trying to keep that in check
Curb
of
it.
who's getting.
Yeah.
I think that's genius.
Agree.
That's a good idea. Now, I know the E thing is the electronic
Oh, absolutely.
prescription is fabulous. If one of my kids are sick and we go to the doctor and they, we're trying to get out and everything's a ruckus and they say, okay, it's already sent over
It'll
to
be
your
there.
pharmacy.
You go there in 5 minutes. Woo!
That's really
Right.
nice,
Yeah,
and we can
seriously.
go there and go through the drive-through
Yeah.
rather than drag a sick kid back out, and
Absolutely,
So I
and
think
sit and
that's
wait or come
fantastic.
back.
But I didn't realize they did that with controlled substances. That
Yes,
makes
they
perfect
do.
sense, though.
Yes.
Now, can you talk a little bit about the wait time again? I know you said what's the typical wait time in urgent care?
Typically, on average, it's 15 to 30 minutes. Now, I will say there are times that you may wait an hour. We really strive to try and get patients through and keep it moving and going, but there's things that we can't control. So we may have 5 or 10 people walk in at the same time.
Right.
And then we try to, manage that and
Sure.
get it going. So you may have a longer wait, but we really strive to have 15 to 30 minutes as far as the wait time.
That's good. I was curious about too, maybe I know it's urgent care, non-emergent necessarily issues. Do you guys offer sports physicals? Do you guys offer vision screenings? I would assume you would send to an eye doctor, right?
Vision screenings would go to an eye doctor. We do sports physicals. We do regular physicals. We do not do any Department of Transportation physicals, though.
Okay.
So for like CDLs
Right.
and that, we do not do that. You have to be a certified physician and go through a certification in order to give those
Oh,
physicals.
really?
Yes. That was a change that happened, I think, a couple years ago. So, but pretty much we can handle anything. If you do come in and we take care of you and we see that it's an issue that needs to go to the emergency room or be a direct admit, our physicians will contact the surgeon, the
Really?
ER, whomever, discuss what's going on, and then get that patient over there. So there's been several times we've had to call an ambulance to come get a patient.
Wow.
There was a time we had a patient that needed surgery, talked directly to that surgeon and got the patient direct admitted to the hospital.
That's
So we
nice.
work really close with the physicians at the hospital.
Someone just asked, well, they're a small business, but they do perform drug testing to their employees. Just wanted to ask, didn't know, have never done it. And they just asked, can you guys recommend, or do you do it?
We will do drug
You
testing.
will. That's a
Yes,
great
we will.
question.
That is a
Yes.
great question.
I never knew that. And I'm like, should I ask
Yeah.
this question? But so
Yes.
I didn't. So when did that all come about? Is that recent or?
Well, that's recent. And the reason that we started doing that and got certified in order to do the drug screens is because we kind of act as an after hours for our occupational health program. So the clients and the companies that are with them, when they are closed after 5 o'clock, their employees can come and see us. They can get their, pre-employment physical or drug screen with us. They can come on the weekend. So we kind of act as an after hours for that service that we have.
That
So
makes
that's how we
sense.
started into the drug screening and providing
Is that typically paid for? And this may be a unique question. Maybe it's, but is that typically paid for by the company, or is that covered under the insurances of those people, the employees? See if they had insurance through that company. How does that work, or do we not have an answer for that?
Well, typically it's the company that's requiring
Okay.
that drug test is
Yes.
the one that's responsible to pay for it,
Perfect.
because they're asking that employee, okay, to go and have this test done. If there is a work injury, most of the companies will require that a drug screen is done before you do any services
Yeah.
for them, so that way they can see was anything in their system or anything related issue.
That makes sense.
Yeah, absolutely. Let's take a quick time out.
Sure.
We're going to take care of some business with LaPorte Hospital, and we'll come back in about a minute or so as we continue our great conversation here on Younger Life Live here with AM 1420 WIMS, and of course, Younger Life. It's Rick Federici and Mary Anthony. Thank you so much for joining us today.
Hey guys, watch my new bike trick. Whoa!
Accidents happen. When they do, LaPorte Hospital can help you get on the road to recovery faster. With our 30 minutes or less ER service pledge, we will work to have you initially seen by a medical professional in 30 minutes or less. Less waiting, faster care. The 30 minutes or less ER service pledge at LaPorte Hospital. During a medical emergency, every minute matters. That's why, at LaPorte Hospital, you'll find less waiting where you need it most, in our emergency room. In fact, we will work to have you initially seen by a medical professional in 30 minutes or less. And because we're a full-service hospital, we can provide more care if you need it. Less waiting, faster care. The 30 minutes or less ER service pledge at LaPorte Hospital.
All right, we are back here on Younger Life Live. I'm Rick Federici.
I'm Mary Anthony, and this is Patty.
Patty! Woo!
Yeah.
So
We're
great to
talking
see
about
you. Thank
urgent
you.
care, you know, and it is a great discussion. It is, there's lots of questions I think that go, you know, that kind of circle around, you know, ER versus urgent care or after hours or
And I
whatever.
think the understanding of it, as we were chatting
Absolutely.
about,
I
all
think
three
it's
of us.
important to point out kind of the specifics and what to expect. I think that is perfect. I didn't realize you guys do x-rays on site. I think that is amazing. So obviously you do blood work too. And I think that is so important to point out because, you know, it's been we've had it before in the past where we might be out of town and go to an urgent care and, I want to make sure they didn't fracture a bone specifically is what we were there for. And they couldn't do x-rays. So it's after hours, and unless you go to the hospital, which we didn't want to do, and we weren't in town anyways, but we had to wait. And I mean, we had to wait really and get an order for an x-ray, which is silly because then we can always see our doctor when we're back in town. So, you know, and that was challenging. So I think it's very comforting as a mom and always could be a patient. You never know. To know you guys do that there. I think that's fantastic. And I love the fact that you point out how closely you work with the hospital and the doctors there in case a patient does need to be directly admitted. You know, it could be a case of pneumonia and they not know that they have pneumonia and you do an x-ray and see this is serious business. Yes. That's typically, especially if it's a child or something, you would just admit them, I would think, or send them right over. So I think that is fantastic. Yeah. I did want to ask you if you have any stats at all on the number of patients that visit urgent care in a year's time or so, or even this past year.
Yeah. So actually this year, looking from January to October in the 10 months that we have gone through so far, we've had about 14,000 patients that have come through. And so usually on a year, we see about 17, 18,000 patients.
That's a huge
Do you
number.
see that climbing? I mean, it feels like it's climbing. I feel like people, it's really nice right now with our ER having such a quick turnaround, but I know that's not always been the case.
Yes.
You know, in years past, that was always a concern is, oh man, if we go because I need stitches, I'm going to be there for the day.
Yes.
Clearly it's not like that now, but I think that's always been a reason. So in your own opinion, do you feel like that is maybe why the concept of urgent care has become so important?
I think so, because with the urgent care, we're really trying to help the emergency room keep those lower type of acuity issues out. So the emergencies that come in, from the accidents and, having a heart attack or a stroke or any of those types of things, that's what they can take care of. And then everyone else that's not an emergent, life-threatening type situation, they don't have to sit there and wait for hours. Yeah. So they can come to urgent care. And you did mention the x-ray. I wanted to say that our facility, we used to be after hours, and then last October we moved to the location that we're at now, and we added the x-ray and we added the lab services. That's great. So that's something that maybe the community isn't aware that we have at our new
right.
facility, but it has helped a lot of, being able to take the x-rays, like you said, we can splint, get that taken care of, and then try and get them referred to an orthopedic if necessary, or, whatever needs to be done for that. So that's a nice thing that we've added, and I think that's helped us with our numbers.
Yeah.
And I can see it growing. I think the more that the community knows what we can do and how we can help them, one, save money, because it's less expensive, and two, save their time. They're not going to spend so much time in the emergency room
Right.
if they come to the urgent care.
I think that the key thing that people always, it's interesting to me to listen to someone complain about having to wait if they are at an ER or something. But I think what they don't understand is the emergency room is designed for literally life-threatening, like you said. And so if someone comes in that I don't want to say just needs stitches. That really stinks. We've had that be the case, and that's no fun. But if you're there and it's just a minor thing you need stitches for where you're not losing a lot of blood, but someone comes in more emergent, they're going to be seen first, as they should be, because it is life-threatening.
Yes.
So that's where those weights come in. And so I think it's a great partnership to have an urgent care, kind of partner up with the ER for that reason, to keep the ER much more efficient. And clearly it's working. I think it's not a coincidence that you guys have added these services in the last year, and that our wonderful LaPorte Hospital ER has shortened their wait time down to 30 minutes or less. I don't think that's coincidence. I think that's because of you guys and what you do at the urgent care. I think that's perfect.
Chris had a question on an instant text saying, can you ask, please, do you have to be 18 to go in there by yourself? In other words, is it an adult? And that's a great question.
That's an excellent question. Actually, in order to go in by yourself, you have to be 18 or older.
Okay.
So if you're under 18, you do need to have a parent or a guardian or someone with you in order to consent for treatment or anything like that to happen. So that's an excellent question.
I love that. That's what I'm saying.
That's important to point out.
People have the knowledge of this. That's why I love this.
Some teenager could, have sliced their finger, not that big of a deal, but think, oh, I know I need a couple stitches, and think they're going to go in, and they can't be treated legally.
That's right.
Unless a parent signs,
That's a great
under the
question.
age of 18.
And that's actually with any of our physician offices. I know we've had some in our pediatric office, maybe grandma's coming in, but parents haven't given authorization for her in order to have the children treated. So there's those types of issues. So if a parent or a legal guardian can come, that's the best situation.
And that is a fabulous thing. And just because I did medical records for a long time, I know we had forms that we were able to give out to parents or legal guardians that could allow or dictate the listed people to take your child in for a follow-up or for a regular visit that you typically would have to sign for. Is that still allowable? Do you guys still have those?
Yes, we do still have that. Yes.
I think that's
it's
a great option.
With people working and how the situation is, they absolutely can. They just have to get that filled out and completed ahead of time. And then that way we have it on record, so we can look and see, is this person authorized to consent for the other person to get treated?
Yeah, that makes perfect sense.
I love the thought too, because folks asking, chiming in about just to kind of clarify sports physicals and things like that for the young folks that are in high school, obviously with their parents with them, but it's just as easy as going in there, getting it done. You guys have the proper forms, you get it all taken care of, and it's done.
Well, it depends on the type of sports physical, the school.
Okay.
So majority of programs, let's say Pop Warner, they have their own forms that they use for physicals.
Do. Wow.
So the parent needs to make sure they fill out their portion of it and bring it in. The high schools usually use the ISHAA form, which is a standard form.
Sure.
So for some reason they don't have it, we can always pull it up. But there's a whole one-page section that the parent or the athlete has to fill out.
Yeah.
Before we can see them. So if they fill that out before they come in, that saves time as well.
Absolutely. Speeds things up for everybody.
Yes.
I know we've done that before for sports physicals. If we've gotten very late notice from the kids, which has happened, and say,
or you forgot,
or I need it. I've actually
I know.
Well, the last couple years, I've gotten in the habit of just in the summer before we go back to school, I make an appointment with our pediatrician, and everyone has their sports physical, and I take all the papers in. Here's this kid. They probably dread that visit because it is a long one, but it's much handier. But we've had it before in years past where the kids will sign up for something, but they come home that day and say, they said we need a physical or we can't practice tomorrow.
Exactly. And you're like, oh, I
so
love you.
We call around to different places to come. So
you can go
I
to
think it's
urgent care,
awesome that you guys do that. That is,
And we do offer for the sports physical, if you pay at the time and pay cash and you're not going to run it through your insurance, it's $25.
Wow.
that's
I
a
think
great
it's
deal.
awesome.
Great price.
$25. Very good price. Pay up front, cash, get the physical, and you're done.
That, just so you know, that piece of marketing information is brilliant. I bet you there are a lot of people that don't know about that. Number one. Number two, the
Absolutely.
organizations should pass that info along.
Well, they
if
should. The
they're
schools
local.
should. I think
Right.
the schools should let the kids know that, because I feel like that is a
It's a middle class family kind of
well, that's
taking
nice.
care of people.
And and
thing.
then insurance, that everybody's happy then.
Yes.
Insurance isn't bogged down by something
Trivial.
Yes, and they take a while to pay,
Yes.
and so then you might get a letter from the whoever did the physical and say, hey, just heads up, you still haven't paid for this, but insurance is still out. You know what I
Right.
mean? So I think that would be fabulous. $25. That's
It's really nothing.
very reasonable. That's more reasonable than anyone else that I've heard of, and we've visited a lot of places for those things. So
I said, I look around too, and I haven't seen anyone at $25.
haven't.
It's more than that.
it's like 40. Like that's been in
Yes.
my experience the typical we've paid for.
Ladies, let's put our headsets on real quick, if you wouldn't
Okay,
mind, because we
sure.
do have a call here into Younger Life Live. Feel free to call us anytime. Mary Anthony, Rick Federici. Thank you, LaPorte Hospital, 219-861-1632. Welcome to Younger Life.
Hi, everyone. It's Jenny Heath. How are you?
Hi,
Hey,
Jenny.
we missed
How
you
are ya?
this morning.
How are you?
I'm well. Happy 50th, Rick.
Thank you so much. I appreciate it.
That's
Woo-woo!
so awesome.
Thanks.
So I heard you guys talking about sports physicals, and I wanted to give you guys our experiences with it, because I have two children who participate in sports, one in Pop Warner, and then one who, is just in various sports at the high school, and we have had the best experiences with the LaPorte Hospital urgent care and the sports physicals. They've been phenomenal for us.
Great.
That's
We've actually
wonderful to
visited
hear.
3 times this year because the schools won't take the Pop Warner forms that we use for my son.
Oh no.
But the $25 is far beyond the best deal around, number one. And number two, you're getting a doctor to do it, an MD to do it, not just, someone at a local, clinic at a drugstore
Sure.
or pharmacy.
Yeah.
And,
yeah.
really, you can't beat that. You know it's going to be thorough. You know it's going to be done right. And for $25,
Yeah.
we tell everyone we know.
I think that's
That's
awesome.
great. Thank you. That's wonderful to hear.
Yeah,
Oh, you
it's the
guys
best
are
deal I
welcome.
know that I
And-
haven't
and
heard anywhere else
Your
that cheap
staff
either.
out in the office in LaPorte, on the south side of LaPorte, it's easy to get to, and they're all nice.
Aw.
Yeah, there you go.
It's a
They
fantastic
are.
experience from us.
The staff is wonderful. They've been there for a long time. They work really well together. They help each other if necessary. So I'm glad to hear that, and glad to hear that you've had a wonderful experience, and the staff and everyone was great.
And can I ask you a question? Is it a long process? I don't mean to put anybody on the spot, but
It
when you go
really
in,
wasn't. I don't go back in the room with my middle daughter, who's now 16. I let her go by herself. And then my son, usually when it's my husband or I with them, so I step out of the room when they do the exam part, just because I don't feel like I need to be in there for that. He's 12, and there's some sensitivities growing there, and
Sure.
different things. But no, it's really quick. It's very
Wow.
efficient. Again, as long as you have your paperwork filled out and with you, the process is going to move along faster. But no, it's been amazing, just amazing. And like
You're
I said, we
awesome.
tell everyone we know. So, when we start looking at Pop Warner sign-ups, if they're not going to have a doctor there who's going to charge, probably $20, if the parents don't want to get it done there, we tell them to go out to LaPorte Hospital. Their clinic will do it. It's $25. You'll be in and out, and you can go. You don't have to go during your work hours even.
Yeah.
That's
yes.
what's
You
super
can go
nice.
after work, and you don't have to take time out of your other schedule.
Right.
a
You
great
can go after
point.
work. You can go on the weekend. I think the weekends is super nice. As a working parent and everything too, having those later hours of the weekend. And thank you so much for calling in and sharing your experience. That's just wonderful. It's so great to hear.
Oh,
Thanks,
no,
Jenny.
thank you for offering the service.
thanks, Jenny. Have a wonderful
Thank you
day.
so much. Have a good day.
Thank you.
All right, you too, guys. Bye-bye.
Bye.
Bye.
Great call. That's what I'm saying.
That's-
that
that
to
is
me
fantastic.
is phenomenal. And by the
I
way,
mean, what validation, right? That's
Right.
perfect.
Absolutely.
well, questions like that too, we encourage 219-861-1632. People instant text us as well, and this is why we love Younger Life. It's just to educate the knowledge and people
Yes.
helping people.
Jenny commented on how easy the clinic is to get to. Could you tell us again where the urgent care is, and give us the phone number again for someone that might want to look it up, as well as the website. I think that was genius. Wasn't even aware you guys did that.
Yes. So the clinic is located off of Monroe. It's in Sagamore Plaza, and the address is 508 Legacy Plaza West in LaPorte. The phone number is 219-575-6244. And again, if you want to do online check-in, even for sports physicals, for whatever it happens to be, you can do the online check-in. So you go to the website, which is www.laportehealth, all one word, .com. And at the top, you'll see something that says services. You just hover over, it'll show urgent care. You click on urgent care and it'll bring you to that page and it'll show you the available times. You click on it, it'll ask for some basic information, name of the patient, what you're there for, do you have insurance, what type of insurance, and it kind of just gets you in line and you're checked in and you're at that time waiting for you to come in.
I love that.
I think that's
let's take a
great.
quick time out. We'll be back here in a few minutes on Younger Life Live. Rick Federici, Mary Anthony, thank you so much for the calls.
Hey guys, watch my new bike trick. Whoa!
Accidents happen. When they do, LaPorte Hospital can help you get on the road to recovery faster. With our 30 minutes or less ER service pledge, we will work to have you initially seen by a medical professional in 30 minutes or less. Less waiting, faster care. The 30 minutes or less ER service pledge at LaPorte Hospital. During a medical emergency, every minute matters. That's why, at LaPorte Hospital, you'll find less waiting where you need it most, in our emergency room. In fact, we will work to have you initially seen by a medical professional in 30 minutes or less. And because we're a full-service hospital, we can provide more care if you need it. Less waiting, faster care. The 30 minutes or less ER service pledge at LaPorte Hospital.
What if I were to tell you there's a one-stop shop for all your national news, as well as local weather and traffic?
Now, would that be something you might be interested in?
Boom! I'm a matchmaker. I love it.
Hi, I'm Nick Cohn. Join Gordon Deal and myself weekday mornings from 4 to 6 for all your national news, as well as local weather and traffic across the Chicagoland, Lake Porter, and LaPorte County areas. You can catch us here on AM 1420 WIMS, or you can download the TuneIn app and find us there, or simply stream live at WIMSradio.com.
It's one thing to be aware of breast cancer. It's another to do something about it. Here's to the heroes who make pink so much more than a color. Act, donate, get involved at Komen.org/morethanpink.
We are back here on Younger Life Live. You having fun, Patty, huh?
Oh, absolutely. It's great.
Isn't this great? I so appreciate
And I love the food.
Thank
Yeah,
you.
I know, right? Now you came on a wonderful day, Patty.
sure did. It's
You
great.
came on a wonderful
Everything.
day.
We
That
are
is
all about
fun.
that. Younger Life. We're kind of just celebrating life and love today. And
And
the
Rick,
balloons,
Rick's
the balloons.
50.
Rick's
Do you know what? I
50,
noticed this in the
50.
cameras. Look at this. Thank you, Patty. Thanks for reminding me. But, I don't mind. Age is only a number here on Younger Life. It is only. But look
It's
at how
nice.
weird this looks in the camera. It's like there's a star above my head.
Oh, well, look, it's
I know,
highlighting
it's
you on your
crazy.
birthday. It's highlighting you on your
I love
birthday. How
this.
funny.
This is
Yeah.
great, though. But I'm so
It
glad
is
we
a
had
great
this time to-
conversation.
to
And,
talk about this.
Even when we were playing the little hospital piece right there, Patty and I were chatting about where they were at and how it's such a great area right there. We happened to be the sports medicine and the ortho, which was right there by it. What last broken bone we had in the family. So I didn't realize that is where how long have you been located in that building? I mean, not in the sports medicine building. The building that you're in is one of those in the medical complexes, kind of by Little Caesars. How long have you been in that building?
So the urgent care has been there about a year, but we
Okay.
also have several physicians in that area.
Yes.
So we have primary care physicians. We have Dr. Kakar, Dr. Pajanbek, Dr. Pickford. We have Dr. Wieland and Dr. Sean. We have a couple nurse practitioners, Alicia Burquest, Maureen Paneras, Suzanne Smith. So we kind of have a great little area where we're all together along with the urgent care. So if someone's out, like I said, if a physician's out or on vacation or booked for whatever reason, you can go there and you know that the information's going to get shared, or we can get you hooked up with one of them to be your primary care provider.
What I
It's a
loved
nice
about
spot.
this, Mary, is I think too from an educational standpoint, I remember doing a piece when you and I first started Younger Life, and I'd gone over there kind of to do like a little field trip. I was blown away, and I'm so glad you guys brought
Yeah.
this up, because we did have a text message asking for, they weren't sure, they were kind of confused where it was, and that's what prompted you
Yeah, I
ladies
was
to kind of
talking
talk
about
about
it.
that. But there are a lot of doctors there, and it seems to be expanding big time. It is, and I like the way it's a complex, it's a campus.
It is a campus. That's a great way to
great
put
way
it.
to look at it.
And it's so nice in through there. And it is well marked. It can
Yes.
it seems confusing to anybody pulling into any sort of medical complex or campus because you're thinking, okay, wait, which one do I need? But they are marked very well. There's beautiful signs.
I would say
up
we
and-
did improve signage. So we do
Yeah.
have a large sign out on Monroe. And
nice.
then once you turn into Sagamore Plaza, there's big signs that tell
Everywhere.
you which way to go,
Yeah.
where's urgent
That's
care. And, and then, like you said, having sports medicine and orthopedics and our therapy in the other building, which is right there. So we have a lot to offer just in that little in that
Yes,
section
it
right
is.
there.
And that is a beautiful area right there. That building is gorgeous and
Yes.
really added a lot. So that's nice. And at least hopefully that makes it clear, exactly where you're going for the people that are familiar with LaPorte. So, or maybe not so familiar, but they're going to see some of these places and go, oh yeah, that's where it is. And it's right back there. I mean, I can't say enough. I think Jenny hit it right on the head. You can't find a better deal and know your child is getting a good quality physical. It's the same if someone
By a doctor.
has something wrong.
Yes.
Something minor wrong, but it needs to be addressed and not wait until the next day or wait until Monday, through a weekend
Right.
without having to take up time in the ER for those people that are there for life-threatening things and not waste your own time. So
Right.
Do you see in your children, personal question here, I hope you don't mind me asking, do they want to follow in mom's footsteps? Like, do any of them want to get into the medical profession?
That's an excellent question. So actually, yes, my son, he's a senior this year at Washington Township, and he wants to get into sports medicine.
Beautiful.
So I'm going to plug sports medicine real quick. In that building that's right there, Dr. Sarah Bancroft is her name. And with
we've
sports
love her.
medicine,
we've talked to her.
have you?
great.
Isn't she
Amazing.
wonderful?
Awesome.
So too, like sports physicals, she will do sports physicals. If you come in and you have a fracture, doesn't require surgery, just needs casting, you can see Dr. Bancroft.
Wow.
You don't have to go to an orthopedic. So we have
That's
that available
awesome.
too. So a lot of times, if people come into urgent care with a fracture, we can refer them to Dr. Bancroft and get them in instead of going to an orthopedic and seeing a specialist. Because
Wow.
she can cast you and take care of that issue and
I'll
anything
tell
that
you
needs to be
what.
done. So sports injuries
Yeah.
Dr. Bancroft is a wonderful person to go to.
She was awesome to talk to.
Yep.
And we also out at the fair, LaPorte Fair this
Yes.
year, the LaPorte Hospital had a tent out there and they did a different theme every day.
Yes, we
she was out
did
there a
the-
couple times with
yes.
sports medicine. I was there and she's awesome. We actually had her husband too, who's
Yes.
in ear, nose, and throat. He
One of my
joined
favorite
us.
guys. I love
he
that
was
guy.
Great too,
awesome.
isn't
he? I love
He's
him.
so
Yes.
funny.
Great.
He is,
I mean,
yes.
they're an awesome couple.
We need to get
but
those guys back on.
What a power couple,
Yeah.
man.
Absolutely.
So they were cool.
Cute.
But the last break that we had in the family, we were where they cast at is in this this big room in the sports medicine. It was a therapy room is what they said.
Yeah.
It was awesome. I said, this is so cool in here.
Yes.
Like I had not been back that far. We'd seen an ortho, but we had not gone into there. And it was so cool. It was just such a very, very new and up to date and just awesome, really cool
And
building.
she offers different colors, and
Yeah,
she'll do
she does.
stripes, and she'll put glitter on. My daughter broke her foot, and so she had a pink cast with black striping and glitter.
Oh,
and
how
that was the
funny.
big thing, and everyone was like, "Oh, we've never seen that type of cast
Yeah.
before." So she'll make it fun for
Aw,
kids, so
yeah.
that way it's not quite as bad.
Because it isn't a fun thing. Nobody likes to have, a break or have to deal with the cast. I know kids at first think they want them. They all
No,
think
yeah,
that,
they do.
Get about,
No,
two,
they do.
about 2 hours into it, you're like, you're done.
Yeah,
Yeah.
and then you're
My
this
foot hurts.
stinks.
I don't like these
Or
crutches.
it's itching and it's just
Yes.
uncomfortable and putting clothes on and off it can be very difficult.
Yes.
So I think the kids always think they want that. But
And she does offer as well waterproof casting.
Yes,
And
that's
it really
what I want to
works.
It's crazy.
It really works. You
I
can get
could
it
see,
wet.
I could see the medical professional and you going, okay, let's try this, kids.
Yeah.
Let's do it. Come on, let's see if it works. That's
Yeah,
really
I
cool.
wanted to test it out.
It
so,
is cool.
Go swimming. Dr. Bancroft had her one son. He had on a cast. They went to Florida. He swam the whole time. It was a waterproof
Wow.
cast.
Yeah.
It's amazing.
It is.
That
And
is
you don't have to
great.
cover it trying to take a shower.
That's it.
bath,
So
or,
I
you know.
can't believe that you're a mom. You guys are both look very young, and I know you guys have daughters and sons that are in that junior, senior range. I know both of you are probably doing this. Are you guys focusing on the college choice that you don't have to say where? Have you gone to college days and things? Because that to me that was a couple year process for both of my daughters.
Oh, yes.
I mean, it's crazy.
It is. It really is. So my son that's a senior this year, we've had lots of information coming in from colleges and, just trying to look at it and think about it. He has been accepted to 2 colleges.
Nice.
Oh, that's
Very
which
good.
is great.
Congrats.
And so now I said, okay, we really need to start thinking about where do you want to go?
Yes.
Yeah.
And he's waiting for a few more to see if they're going to accept him or not. But that's a whole learning thing as well about, college and
Yeah.
how that, it's just
The
it's
process.
something
It's
else.
crazy.
It is.
Yeah.
Absolutely.
Get ready.
I know. I'm trying to hang on my seat, and then the bill for that will
Of
be
course.
fun.
Oh,
Well, and that's what it is. And I say that because a lot of the middle class families that are out there, it's tough. So I'm just going to throw this out there as a side plug.
Yes.
FAFSA and some of these other things. If you can, try it. Get in tune, but going with your son and daughter and letting them, I always say it's like say yes to the dress. When my daughter Devin knew the college, and same with my other daughter, she walked up to the campus. We've chatted about this. She knew. But we went to big ones, we went to small ones. She wanted the campus college life, but she's a 4.0 kid. And, in nursing,
Yes.
you've got to be focused.
Oh, absolutely.
I
You
mean,
have
school
to-
in general, but,
Right. You have to pay attention. You
sure do.
Yeah. And also, too, when you go, you can talk to them about financial and say, are there scholarships available or what's available?
It's awesome.
And it's amazing what they can do.
Keep it up.
Yes.
You're a cool,
I'm
young,
trying.
hip mom.
I'm trying.
So if you don't mind me asking, what are the ages of your 4?
Sure. I have a daughter that's 25.
Do you really?
I do, yes.
Wow.
Wonderful. Her name's Jessica.
Hi, Jessica.
And then I have a son that's 21 that goes to Indiana State.
Nice.
Oh, good.
His name is John. And then my son that's a senior, I've talked about, his name is Chris. And then I have my youngest daughter, she's 11, and her name's Maggie.
That is wild.
Yes.
You're all over. What
All
are your
spread
ages?
apart.
Well, we have 16, 13, 11, 6, and 4. Get ready to turn 5.
Man.
So
Thank you,
it's a
Lord.
blast.
That's a lot. Wow.
Yeah, but
You're
it's
busy.
It's busy, but it's busy and it's
Keeps you
fun.
young.
It doesn't
Yes.
matter. It's busy and crazy.
Absolutely.
But my daughter she's a junior this year, so my oldest will be a senior next year. And my youngest will be in kindergarten next year. So I joke that for 1 year they'll all be in the same school system.
Wow.
For 1 year only.
Yes.
So it's neat. And
Wow.
the college thing is very overwhelming.
It is. It
you know,
absolutely
my
is.
daughter, my oldest, all my kids are very good in school, but my oldest daughter, because of her age and stuff, we get so much stuff emailed and mailed, and it's just, it's
a lot of
overwhelming to
junk
look
mail.
at. It really is a lot
It
of
is.
junk.
A lot of
and
postcards.
a lot of
lot
come
of
and
stuff.
see us.
Yes.
And let us tell you why you want us, kind of thing. But
right.
it is a lot, and it's a lot of money. It's a lot of time, and it is a difficult choice, I think, for parents as well as the students. So
Yes.
I think it is interesting, though, that your son wants to go into sports medicine, and this is a
Yes.
great time to do that. There are so many options, and can be such a cool career too. So
I think what drew him to that was all of his injuries.
really,
Yes.
yeah, I
We
understand.
spent
that.
lots of time with Dr. Bancroft fixing many injuries
Doc
with his
Bancroft,
ankles.
both of
Yes,
them.
wonderful.
Yeah, both of them. Yeah.
Well, ladies, we're
She's
going to
awesome.
call this one to a wrap. So on
Yep.
Younger Life, thank you so much. Your intelligence, your knowledge.
Oh, thank
awesome.
you.
Patty's coming back someday.
I think it'd be
Absolutely.
great. I think it'd be
You're
Absolutely.
great.
great.
Thank
Thank you.
Thanks to Karen and the crew, of course, at LaPorte Hospital. I'm Rick Federici.
I'm Mary Anthony.
AM 1420, WIMS, Michigan City, a Girard Media Company station.